Before we dive into today's nursing experience episode, I need to show you the redneck engineering. This right here that you are seeing is my phone taped to a chair with yellow tape because I had forgotten my equipment that day and I didn't want to cancel it, so I had to use what I had. The conversation was fun. I hope you guys enjoy it and you take something good away from it. But the video is not the best. The audio quality is good, but I'm working. Trust me, I am working to get a better video quality and a consistent good video quality for the show. But until then, I hope you guys enjoyed today's episode and just have fun. Welcome to the Nursing Experience episode 4.
Thank you.
Thank you.
Thank you so much for attending. So, we'll start by you introducing yourself. I want you to say your name. You don't need to give your full name, but your name and what year and what program.
Okay.
All right?
Okay.
And then we'll go around. So, you may start.
Okay. So my name is Erin Hobbs. I am in the 3rd semester of the Associates of Nursing program.
All right. So, ASN.
Yes.
And how about you?
My name is Rashad, and I'm in the 2nd semester of the BSN program.
All right. 2nd semester BSN. All right. How has it been going for you so far?
It's been going pretty well considering I work full time.
You work full time and you're in the nursing.
Yes.
All right. I want to touch on that a little bit.
Okay.
How hard is it? Because I've heard that the nursing program is tough as it is, especially BSN. So how tough is it for you to work full time, manage a full time job, and the nursing program? What challenges have you faced?
Time management, because you have to study,
Okay.
but you also have to work to pay bills. And then you have to be in class, and then you have to rest. So you have to juggle on all that.
All right. And has it been working out for you?
Yeah, I've been doing pretty well in my classes. Yeah, I got a 3.0, so far so good.
All right. All right. That's good. That's good. How about you? Do you feel the same?
So Rashad, I don't know if you have children. No children? Okay. So I work as well, but it's part-time. And I have 2 children at home. I have a soon-to-be 13-year-old and an 8-year-old. I am married. So like Rashad, you do have to juggle a lot of that. I did try the first semester back in 2022, I believe, and I did not do well. I failed pharm class and had to re-enter back into the program.
Okay.
But because I tried to strictly just have a school life and not a home life, and that
Okay.
did not work well for me or my children. So coming back into it in 2023 or 2024, I don't remember what semester it was, I was able to find that balance where this is school and then this is home.
Okay. I've talked to a few nursing students so far, and some of them have actually mentioned the same thing that you did, which was they started nursing, but then they had to drop out
Mm-hmm.
for a time and then re-enter. Could you tell me a little bit more about that? How does that work?
So I did not drop at the withdrawal date because I said I will fail, but I will not quit.
Okay.
So I knew by withdrawal date I was already failing and that
Okay.
I could not make any of that stuff up. But I wanted to go through, keep pushing to see if maybe by the grace of God I could pull it out. So what happened is they go ahead and let you know you're not coming back next semester. You have to repetition. There has to be availability in the next semester for you to come into that cohort. So I did the petition and then I just waited. And then they make you petition in the summer and you have to wait till like October before you know they're getting back into the program.
Okay.
But what I did with my time, because I'm like, if I quit now and go back to work full time and get used to 2 incomes again, I'm not going to go back to school and finish this. So I went to my advisor and I said, what else can I do in the meantime for these 6 months that I have to wait? She said, well, you only need 2 classes on psychology to graduate with an associate's in psychology. Do you want to do that? I'm like, oh, yeah, absolutely. Let's put that on there. So I did have something to keep my mind occupied, to keep my mindset into the learning and training with education and trying to keep that. Because if I would have quit doing that, I would have had to go back and start over again and refresh my brain on get back into school status.
Okay. Okay, that's interesting. So if you let's say you fail a class you can't continue nursing, right?
No.
You have to retake it.
Yeah. You have to wait till the next cohort comes through.
Okay, so when the next cohort comes through, and cohort is the class,
Right.
you join them, and do you only take that class, or do you take the full course again?
It's up to you if you want to retake the full course. If you pass the other classes, you don't have to take them, but you have to understand you're a year off from what
Yes.
you just learned. So
Okay.
it would behoove you to retake that class, but then you risk a chance of failing that other class that you've already passed.
Yes.
So I did not. I just retook pharm. I did not retake foundations.
Okay.
So
And
yeah.
then you just continue with them as time
Yes.
goes on.
Yes.
All right. So how about you? Is this your first time entering
Yeah,
nursing?
this is my first year, because I was a teacher for 15 years prior to
Okay.
becoming in nursing.
Okay.
And one of the biggest difference between teaching and I noticed in nursing is teaching after so many years, you know what you're walking into. You're going to have your good days and your bad days. With nursing, you could be a nurse for 10, 20 years. You will never know what you're walking into because it'd be something different every time. And another thing about nursing that I noticed too is to get in the program, you obviously have to be intelligent. But to get out of nurse school, you have to have intelligence and critical thinking. Because, see, every situation not alike. Because, see, in one scenario, there might be a patient that's bleeding, and he's the priority. But then in another scenario, you might have two patients, one's bleeding and one's choking. Then you have to decide which one's the priority. And it's the one that's choking the priority because the bleeding, they take less priority. So you have to use your critical thinking to be a nurse. So that's what they're teaching us. Because like I say, it's so much content you have to learn, but then you have to take that content and apply it to real life scenarios.
So would you say you have to rewire your brain?
Yes.
Because you come from a nursing perspective, and you come from you used to work.
Mhm.
You didn't have a degree before, right?
No, I did not.
Okay.
Mhm.
So did you guys have to rewire your brain in the sense of you're teaching? Which year?
I taught high school,
High school.
human anatomy and physiology.
Okay. So
Okay.
you were teaching high school. Did you have to change your mind in the set of coming into nursing? Do you have to switch your mindset completely, or
Yes.
okay? And how
I
about
would say so. Yeah, you have to, because a lot of things is common sense.
okay?
Nursing, yes, it is common sense, but you have to have those critical thinking skills. You have
Okay.
to.
Okay, and that's something they teach you.
Yes.
Yes.
Okay. Before we continue, because I can't see the camera like I told you, if you want, you can move a little bit to the left so that your microphone doesn't, or so it's not in your face. Now I can't. Don't mind. It doesn't matter. I mean, okay. So let's continue. So you have been in the ASN program
Yes.
for 3 semesters.
Yes.
And you have been in the BSN program for 2 semesters.
That's correct.
Yes. So we'll start from this way. What has been the toughest thing for you in the ASN program? Now, we're not thinking about the year that you had to redo. Like
Yeah,
in general, what has been the toughest?
Probably pharmacology
Okay.
is by far the hardest class.
Okay. Why would you say that's the toughest?
There's so many disease processes that a medication can treat, cure, manage. Cardiovascular is a big one. It may be made for cardiovascular, but you're taking it for blood pressure. But you have to watch all the side effects with cardiovascular meds because it causes a multi-organ system function. So if you have liver disease or kidney disease, you can't take certain medications that may help your heart because your system does not eliminate those and process those out the way a normal person's would. So if you're older and you have a decline in some of those things, you really have to watch what you're giving your patients and what they're eliminating to prevent a toxicity or an overdose on a medication.
So have you had pharmacology yet?
Yes, we take pharmacology in both cohorts, ASN and BSN. And pharmacology is the first course you take.
Is
It's the first course you take. And I agree with her, it's pharm. Because, see, here's the thing about pharm. You can study the same medication, but you're not going to apply the same method to the same patient. Because, see, if you're dealing with an adult, you're going to monitor one thing. If you're dealing with a child, you're going to monitor another thing. And if you're dealing with the elderly patient, you're going to monitor another thing. I'm just going to break it down to you. When you're dealing with the elderly patient, the biggest thing you're going to monitor is kidney and liver function because they function slowed down. When you're dealing with the adult, like let's say for steroids, you monitor blood sugar because it raises your blood sugar. When you're dealing with a child, while they're still growing, you're going to monitor growth. So each stage in life, the same medication now, but depending on the stage in life they're in, you're going to educate on something different.
That's interesting. I've heard about the cardiovascular being big.
Yes.
It's a big no.
If you have your heart, then you don't have
Yeah.
anything left. So
Exactly. So I've heard a lot about that medication, but do you have to memorize a lot of things in pharmacology, or do you have to understand it? Which is it?
Understand it.
definitely understand it.
The patho. If you understand the patho, the memory will take care of itself.
Okay.
I think you have to memorize the drug endings
Mm-hmm.
Okay.
a lot too, because those will tell you what kind of medication it is and what system it's affecting.
Mm-hmm. I agree.
What do you mean by endings?
So if something ends in OLOL, that's a
Okay.
beta blocker. You have to know what that beta blocker is going to be used for, and if it's going to be used for a blood pressure issue or a heart issue.
Okay, so there's a system.
There's
for
a
it, kind of.
system generally, but you also have to take into consideration if it's African American, if it's white, if it's Asian, because we all react to medications differently.
Okay, so there's a lot. Okay, there is a lot to take in. Basically.
There is.
Okay,
Very much.
And do you think that is what gets you as a nurse? In the beginning, at least, because you might be overwhelmed. Because I'm thinking from an aspect, you're doing core years.
hmm
You're just studying one subject.
Mhm.
And if you mess up on that subject, it's no big deal. Biology, if you mess up in biology, no big deal. But once you get into nursing, like you're saying, there's a lot on you have a lot on your plate, and mess up is different here than messing up in history.
It's your license.
Yeah.
I mean, and you're the one who read the order, got the medication, gave it to your patient, and the doctor's not going to stand behind you on that. But like, I ordered it. It was her job to do it. So it's a huge liability field.
Okay.
I mean, I would say even bigger than their service enforcement officers. I think it's bigger than that.
Okay. And
I totally agree.
You're nodding, so you seem to agree.
Yes, because you're making life and death decisions every day. Something simple like insulin or blood pressure medication. If you give them too much blood pressure medication, you can bottom them out and they can die. You give them too much insulin, they can bottom out their sugar and die. So even the simplest tasks involve life and death.
Okay. That's interesting. That's good to know. So
Mhm.
I'll keep that in mind.
Mhm.
I'll keep in mind. We get to know if we get into the nursing program this Friday.
Okay.
So we're excited. We're all,
Yeah, we
getting
need you.
ready.
We need you.
Hey, I hope I get in. But I was speaking to other people and they say when you get in.
Yeah, when
And
you'll get in, it's
Yeah.
getting out.
Yeah.
I have to say when I graduate, not if I graduate.
Yeah,
'cause
when I
you got to
graduate.
keep that mindset
Yes.
into you.
Mhm.
They
Yes.
want fear to creep in there and to weed yourself out, and you can't let your mind get like that.
So for me, I have this where I don't want to set the expectations to not be disappointed because I want to know what course of action to take. Now, I would love to get in, but I kind of have that in the back of my mind. So that's why I have a little bit hard time saying, okay, when I get in. But yeah, I guess when you say when I get in, it can be now, it can be next year. So I'll go with that. When I get in.
I will tell you that when I applied for Gordon's nursing program, I applied for 7 other schools
Okay.
because I did not think I was going to make it into Gordon. So when I got my congratulations letter and email, I was like, I got it. I made it. Oh my gosh.
Okay.
Like, that was the only school that called me back and said, congratulations, you're in. So I was like, that was meant to be. I don't know why I worried myself with other schools because God knew where I was supposed to go and where I'm supposed to be.
And you were working here already.
Yes. Mhm.
Okay. And you were working as a teacher, you said.
Yes.
What made you change?
Well,
Because that's a big, change from teaching to nursing.
I just felt like it was time for something different because I had been teaching for 15 years and I was starting to get burnt out with education as a whole. So I just felt like it was time for something different. And since I was already a science teacher, I felt like I could do something science related. So I started working at a healthcare facility as a CNA just to get some like hands-on experience in the healthcare field and to see what I like it. And it turns out that I really do like it. So I just ended up applying for the nursing program, and pretty similar to Erin, I applied to other schools as well. But once I got Gordon's congratulation letter, this is the one I chose.
Okay, so did you get accepted into other?
Yes, I did.
Okay, you did. Okay.
I never heard back from all the other ones.
Hey, this is all my baskets is in one. All my eggs is in one basket here too.
That's it,
So, oh, you guys touch on a lot of things, and I was like, which route should I take now? Which route should I take? But this college is top in Georgia, from what I've heard.
Yes.
I think 4 out of 60.
That's right. That's right.
4 out of 62.
That's
Mhm.
correct.
Something like that,
Yes.
and it's very, very competitive getting in. My understanding is getting into BSN is a lot harder.
It
than
is.
Getting
Oh,
into
absolutely.
ASN. It
Mhm.
is.
Absolutely.
Okay, so it is a okay.
Yes.
Okay.
Just to add some context to that, I'm one of 3 males in my cohort. There are 3 males in my cohort, and I'm one of them. There's a black man, which is me, a Caucasian guy, and a Vietnamese guy. We're the only 3 guys in our whole cohort.
Is his name Nguyen?
Knowing that's correct.
Yeah, he is. I went to get help from him for the TEAS exam.
Mm.
So shout out.
Oh yeah,
Shout
shout
out
out,
to
yeah,
him.
yeah, shout out Nan, yeah, mhm.
Yeah, there are a lot of people who are actually helping with TEAS and all that. Speaking of which test did you guys have to take?
I took the T's.
You took the TEAS too?
Mhm.
And which test did you take?
I took the Kaplan.
The Kaplan? Okay, so you got the Kaplan before they got rid of
Actually,
it.
no, I take that back. It was Kaplan.
It was Kaplan.
Yeah.
I was about to say, because I think we're the second generation
Okay.
TEAS.
I'm we
not
do
sure.
T's now in nursing school, so that's what threw me off. Because we did Kaplan the first semester, but we switched over to the T's method.
Yeah, okay, so you did the Kaplan.
Yes.
So did you. How hard was it? Oh,
It was hard.
It was hard?
Yes.
Okay, have you guys taken TEAS prep tests?
No.
Anything? Okay, so you can't.
I've actually taken the T's actual test. Like I say, I applied to other schools and they require the T's, so I've taken the T's and listen.
Okay, good.
Yeah.
So you've taken both tests.
Yeah.
Which one do you think is easier?
They're about the same.
They're about the same?
Yeah, but I think the T's is more geared towards getting you ready for nursing school because it's made by ATI.
Yeah.
And when you get in nursing school, all your modules gonna be ATI. So
Okay. Yeah, because we're before we took the T's, what do you say, proctor
mhm.
was reading out, you're not allowed to talk about the T's regarding this and that, and if you do, you can get prosecuted. And I was like, okay, I don't want to talk about it.
The
But-
ATI proctored exams are the same way.
Okay,
Hmm.
but yeah, it would be because you have to take the NCLEX when you want to become the
Right.
nurse, when you want to become get your license. But the T's, I would say for me, it was more like general information about the subject. So you have English, reading. It wasn't that in depth. It was just like critical thinking.
Mhm.
That was a lot of critical thinking that you have to do, and I think it's a good kind of prep. But compare those tests to your tests in nursing. Are they similar?
I would say no.
No.
No,
Mm-mm.
because from what I've heard on your tests, you can have 4 options. You can think all 4 options are correct. It's just which one.
Is the best,
Is the best.
answer. Yes.
So that's how it is?
It is. Yes. And if you have to meet within so if you make below 75 on your test, you have to do a remediation with your contact.
Okay.
And they'll ask you, what is your rationale behind why you chose this?
Okay.
And you'll explain that. And they'll say, okay, well, that's not wrong, but that's not the best one or the most prioritized or the immediate. So it's very hard because there's things that I would do as a parent going into some of these rooms and having some life experiences that other people would not even think about. But
Okay.
I also like to communicate a lot. I like to talk to you, explain to you, tell you, because that's how I want you to do me if I'm sitting in that bed.
Yeah.
So a lot of options are just select all that apply or select one. And I feel like, well, these two would both go together because I could do this simultaneously. But, it's
So would you say you have to strip your emotions from the test and then just do logic?
yes.
Yes, because see, the questions are not going to save your patient. You have to save your patient by picking the best answer. Like the question is not going to cure your patient. Like anytime you read the question, think worst case scenario.
Okay.
That's how you got to think about it.
Okay. So even if the question is not that serious, or I wouldn't say serious, maybe is not the right word because nursing is a serious business.
Yes.
But when you have questions, should you think that, okay, if I don't, what's the best possible answer to save
Say
the
that is
patient's-
correct.
save
That is
the
correct.
patient's life?
That is correct.
Okay. Do you have
Yeah.
this?
What's the most therapeutic method to
Yep.
save your patient's life? Mm-hmm.
Because the question won't save them. You have to do it. You have to do it.
So have you done clinicals yet?
Yes.
Yes.
Okay. So let's try to apply it to real life scenarios then, I guess. What kind of have you had any encounters like that, like from the test during your clinicals?
Yes.
All right. So how did you deal with that?
The way I dealt with it was exactly how she described by pain medication.
Okay.
But instead of me outright refusing to help him, we took a non-pharmacological treatment with that don't involve medication. Like instead of using like pain medication, which you can't have at this time, let's try an ice pack or a heating pad or something like that. So that way he'll know that we're doing something.
Okay.
Because a lot of patients in the hospital don't want to hear no. Like they don't want to hear like I'm not going. I can't. There's nothing I can do. They want to see me trying. So
Okay.
it's more of a mental thing.
Okay. And your clinical, you've been there for 2 semesters. Do you guys have different clinicals?
Yes, you rotate different sites.
Okay, so you rotate.
So my first semester, I was at hospice. The second semester, I was at the stroke floor at Piedmont Henry, and now I'm at a long-term care facility in Warm Springs, Georgia.
Wait, so you do clinicals the first year?
Mhm.
All
Yes.
right. Which is it like straight from the get-go, or is it more towards the end of the semester?
I don't remember.
I think it's towards like after the 6th
I
week.
think it's after,
At the
yeah,
6th
halfway
week?
through.
Yeah.
Okay.
Mhm.
All right. All right.
Because as you go further, you get longer clinical time.
Okay.
So your first semester, you're getting just a little bit of experience out there. And then your second semester, you're longer days more frequently, 2 days a week. And then now I'm there, I'm doing peds clinicals and long-term care clinicals and OB clinicals.
So is clinicals, is it considered like a class? Do you go just 1 hour or 2 hours?
You go,
or
right now we're doing up to 6 to 8 hours a day.
6 to 8 hours a
Mhm.
day. Okay, that's your clinicals.
Yes.
Yes.
Okay, and then I'm assuming you don't have class that day.
No, mine's on Saturday.
Yeah. Okay. Okay. So you go there, and I'm assuming to give you the feel of the job or what it feels like to be in the field.
You
Yes.
go there to apply the knowledge you're learning in class because
Okay.
you can sit me down and talk to me and teach me a lecture all day long. A lot of times I'm not going to see it till it's hands-on in the hospital. And I say, oh, this is why this is this way and this is how this works. And
Is it always related to your classes though? Like, do they try to match it so it fits your class, or
well, yeah, because if you're taking a pediatric class, I'm in pediatric ER.
okay?
So, and
Okay,
I'm
so they don't send you to like the ICU when you're doing
well, they do when
pediatric.
you're in your chronic or your acute care class.
Okay.
Then they do, yeah. So
Okay,
right
so
now
they-
we're learning acute care, so I'm in an acute care facility.
Okay, so they try to match it together so
Yes.
you can apply your knowledge, like you
Yes.
said. Okay, and how about you?
Yes. I have 2 clinicals. I have a mental health clinical and I have a med surg clinical. So I'm on the med surg floor in the hospital, and I'm in a psychiatric facility clinical as well.
Okay, have you guys experienced any horror stories from
Not yet.
clinicals? Not yet.
Mm.
So
Mm-mm.
far so good. Nope.
Okay, so any good like wholesome stories
Yes.
you have, and have you?
No, not wholesome stories.
Not really. Okay, okay. Look. There's an abundance of them from what I've understood. Speaking to a lot of, or I would say a lot, but some students, there is an abundance.
My mental
they will
health
come.
clinicals definitely did not disappoint. So,
Okay. Okay, why did you say that?
the first week we got there, it was kind of chill. Everybody was pretty relaxed. Everybody had been regulated to their medications or their treatment regimen. So I was like, okay, we could do this. We got to talk to patients about why they're in a mental health facility and, find an outcome, a positive outcome for them. By the third week, they were getting new patients in who had not been regulated on the medication, who were just starting treatment, and they were having outbursts and episodes, and you were like, what in the world is happening? Was it a full moon or what? But it was definitely, if you're not exposed to mental health, it will definitely. We had one girl trying to climb under the chairs to hide from the man that was screaming, but he was just screaming. He wasn't screaming at anybody in particular. He was just having an outburst moment,
Okay.
and I was like, where are you going? She's like, he's scaring me.
Okay, and that was your colleague?
Yes.
Okay.
Yeah.
So I will touch on your wholesome story later because I
Okay.
like to take it more towards the end.
Okay.
But as you guys know, this is the podcast is called The Nursing Experience. So we're trying to include everything we can into this podcast so that people can get as much knowledge as possible so that they can be as ready as they can be. Now, no one could probably be 100% ready, but what would you say is important getting into the nursing program? So since you've already done, you're almost done with a year of nursing, BSN program, and you have done almost a year and a half.
Hmm.
So getting into nursing from absolute start, you get the letter. It says congratulations, you're in. What do you do?
I think you have to be organized first of all, because I think that like the content and all of that stuff, and the teachers are going to guide you through the program if you're willing to pay attention. But you definitely have to become more organized.
Okay.
I think if you have to get like a planner and become organized, I think everything else will take care of itself.
Okay. So could you expand a little bit more organization?
Okay.
Are you talking about more from a time management?
Time management. That's
Time
correct.
management
That's correct. You
perspective?
definitely have to manage your time because
Okay.
you don't have a lot of it, and you have to invest so much time into not only in the classroom but outside the classroom. If you get overwhelmed, it's easy to get behind.
Okay. And I've heard that getting behind is a big no-no in
Mhm.
nursing. It's like if you do, it's hard to come back.
That's correct.
Okay. So time management and organization.
Yes.
So stay organized, have good time management. How about you? What would you say is the most important?
So we had orientation, and you'll have one on your first day as well.
Okay.
I was very overwhelmed at orientation because you have the teachers coming in to talk to you. You have your lip and cod advisor, which is who we have a contract through to use their nursing resources.
What?
Their nursing
What's that?
resources. So it's an online where
Okay.
your books are ebooks now.
Okay.
I don't study well in ebooks. I have to have the physical book. But you still have to purchase that because they give you practice tests, VSIMs,
Okay.
or other things to do on there, which I wasn't expecting. So I'd already bought my books, but I had to spend another $1,500 on the ebooks to
Wait a
get that
second.
done.
The books are $1,500
The ebooks. Mm-hmm.
for the whole for one book.
For one semester. That's what I spent.
$1,500 for one semester.
Mm-hmm.
Holy moly!
Which I was
Okay.
not even thinking to spend, because I'm like, I already got my books. I'm good. No, I had to take my Prep U test, and I have to use my VSIM, and I have to use
So,
the Picmonics that they do. You
so
know,
what
it's-
happens if you can't afford that?
You have to just communicate that with them.
Okay.
Like, hey, I need more time.
Yeah.
You know, but you also have to pay for your background and drug screen to be done by a certain point. You have to pay for AceMap, which is a system that they use to coordinate your clinical schedule with,
Okay.
which is something I wasn't prepared for as well. I don't have a computer or a laptop at home. I'm actually using my child's
Okay.
because that's something I can't afford personally. So, but you can rent laptops through the library now. So that was something that I had to learn to adjust to, is using school stuff or my child's stuff. I'm just now learning how to download the PowerPoint and type into the PowerPoint
Okay.
this semester. This is the first time I've done it because I'm like, I don't know what else to do to make it work, because
Okay.
I don't have a way to print out all those papers for the PowerPoint. So you're only allowed $5 to print stuff at school. So,
Yeah, that's true.
and like, I think I literally sat there in a panic attack for 10 days because I'm like, what did I just get myself into?
After the
orientation, yeah.
Okay.
Because third semester students came in and they're like, are y'all okay? You look overwhelmed. And I mean, I'm sure my eyes were as big as saucers. And I was like, what? Is it too late to drop out? Like, can I just go back and do what I was doing? Because I was comfortable there. I'm not comfortable in the nursing program,
I
you know?
understand.
But I just wasn't expecting those additional costs after paying tuition and everything else that comes along with college. There was
mean-
more, and then you have to buy your uniforms. You have to buy your name tag for your uniforms.
I'm actually working on a list.
Yeah.
I'm working to compile a list, and I'm probably gonna bring it to you guys later just to
Yep.
get your feedback.
Because you have to buy your stethoscope, you have to buy your shoes, and you got to buy. There's a whole bunch of. It's like almost having a new house and not having anything for
Are
it.
there any requirements,
What do you mean?
like shoes wise, or is it just like
Solid.
Solid white, I believe.
Yeah, I got
Solid white?
white or black. Solid
Okay.
white or black. Yeah. But she
oh,
made
so they have to be a certain color?
yeah.
Okay, so you're not allowed to have like
No.
multi-color
Mm-mm.
stuff. Okay.
To touch on what she said about AceMap and background checks, I'm gonna tie it back into my other point. If they send you an email telling you to get this done, don't procrastinate.
Like just get
Yeah,
done.
go ahead and do it. Yeah, cause don't
Okay.
let it wait. Don't wait till the last day is due and then try to
Okay.
Because
Yeah.
that can postpone you from getting into your clinical site. Because
Exactly,
a lot
yeah.
of these are required by your clinical site, not by Gordon.
Okay.
Mm-hmm.
But there's tests, vaccines you have to take. Those are also costly. So all of
actually
that
have-
comes into
I,
it.
I have those now that I have to take,
Mhm.
Hep B and
Yes.
all that.
Quantum Verum Gold.
Yeah, you have to take care of all that.
Yeah.
Now, I'm trying to figure out. Okay, so for people who don't know, we do have a what is it called? I think Lamar Health Department has two. It says on the paper 2 free visits.
Okay.
Now I don't know what free entails. Nothing is really free in this world, but I think they might give you. I don't know if it's a flu shot. I'm trying to figure that out. Could I just ask you to close the door completely? I just noticed that. So I know for a fact that they can help you with hepatitis B and stuff. I don't know how much it costs. I'm about to talk to them about it, but the reason why I wanted to start this list for nurses is because I know that it can stack up quick, like real quick. Because when I was starting to look at the stethoscope, I have a um I have a few students I know that are in the program and have stethoscopes, and then I have someone who's working as I know someone who's working as an EMT. So I started asking them, okay, so which stethoscopes do you think are the best? They were telling me, and I was looking at the stethoscope. I was like, $100 for a stethoscope. I was like, yeah, no, I don't think I want to pay $100 for that. But it's, I know it can stack up a lot.
Mhm.
And now when you say 1,500, you kind of shocked me a little bit. I don't get shocked easily.
Oh,
but
I don't either, but I was
no.
like, oh my goodness, because I just bought my books. Now they were used, and I think I rented even some through Amazon, but then I ended up having to buy them because you still need them throughout the semesters. But another thing is when you do labs, you have to buy a lab bag. That's $120 for your lab bag.
What's a lab bag?
It's a bag that you get at the bookstore, and it comes with all your lab equipment that you're going to use when you do your checkoffs in lab systems.
Okay.
So when you do your blood glucose test, your IVs, your sutures, dressing changes, it comes with all of that in there. Your syringes.
Really?
Yes.
And you can't get that from anywhere else?
No.
Okay. Okay. All right. Then I guess it's time to start looking at what we can, figure out for it. But man, I did not. Okay, that's costly. I guess I'll have to go and talk to professors and see what kind of like tips they have, because I know. I mean, let's face it, a lot of students are not rich,
No.
and this can stack up pretty good. And of course, if you think about it long term, if you're a nurse and you graduate, you work, you can pay that off pretty quickly.
Right.
But in the moment, like you said, you were overwhelmed to the point you're like, can I just go back to my comfort zone? And I think a lot of people do that. It can be very, very overwhelming. So I guess I have to start. I guess I have to start researching.
Mhm.
I thought I was good at research and I was ahead of the game, but apparently not anymore.
That's stuff that nobody told me going into the nursing program. So when I'm sitting there at orientation, I'm literally like nauseous. And oh my gosh, what am I going to do? I have 2 kids at home I have to feed. I have their school fees I have to pay. I have power I have to keep on. Like those are more priorities. And I've told them that before. I'm sorry, I have to keep a roof over my kid's head. That's more priority to me.
And that's exactly why I wanted to start this podcast, because I know there's so much and there's so much perspectives, and it's fun talking to people, because Justin was the first episode. I think he was about 19 years old. So that's very young.
Yes.
All right. We are all above 30, I'm assuming.
Yes.
Yes. So, and then the next group, we had 2 young girls too, who are with me on the path to nursing.
Okay.
They're not nurses yet. They've applied. So we'll all get our answers on Friday, but it's interesting to see their perspectives too. And then the third one, we had 3 nurses that are graduating now in May.
Oh, nice.
So the experiences and all the information that's pouring in is fantastic. And I think, and I hope, I hope this will actually help a lot of people. Because if you listen to something like this and find out, hey, you're going to have to buy a stethoscope for $100. If you can't, you may be able to find one for 50 or 20 or whatever it is, whatever works for you. But just keep in mind, you need shoes a certain color. You need all your scrubs. You need this. This is going to stack up. This is going to be about $2,000 at least.
At least.
Yeah. Will you be able to handle that? So it's a good,
That's on top of your tuition. That's not included in your tuition that you're already paying.
There you go. And if you don't have insurance, you also have to have insurance.
Yes.
So that
Another $1,500.
Yeah, that adds up pretty quickly.
Mm-hmm.
That is wild. That is wild. I still can't get over it. Okay, so but let's move on. So what have you guys seen from yourselves or classmates that you shouldn't do when you get in?
Cheat.
Well, of course. Of course. But I mean, like, so one of the episodes we had, people said be professional. Like,
Yeah.
don't come in and act.
That's exactly
That's what I was about to say.
Yeah.
That's exactly what I was about to say.
Yeah.
Professionalism.
Yeah, like when you go into a lab, wear your scrubs or wear something professional. Don't come, as if you just walked straight from the gym to the lab. So beside that, I would say, so we don't cover the same thing. What would you say, advise people not to do once they get into the nursing
Don't
program?
show up late.
Yes. Punctuality.
But to classes?
Yes.
Or are we talking
Period.
Anything.
Period.
anything?
Period.
Okay.
Yeah, get into that habit of being organized, and like I say, go back to time. Get into that organization mindset. Yeah.
Okay. So don't be late.
No, it causes a distraction when you're
Mhm.
late.
You, my man,
Yes, sir.
you're very punctual. I can say that.
Yes, sir.
Because we were supposed to be here 1:15. This guy was here at like 12:55. He's like,
Yes.
I'm waiting for you. I was like, okay.
Yes, because you try to be considerate of a professor's time, and you try to be
Yeah.
considerate of your own time.
Yes. Yeah, that is actually that's actually very nice. And I think the Japanese have, I don't know if it's the Japanese, but I think this goes around many parts of the world, but they say if you're on time, you're late.
You're late.
But if you're too early, you're on time.
On time. That's right.
Exactly. So be on time.
Well, when you're getting in class late, you got to get your book bag down. You got to get your purse down. You got to get your keys out. I mean, there's still a longer distraction than you coming in and opening the door.
You got to unpack your Stanley if you're one
Right.
of those. Yeah.
Right.
Get ready with me, Stanley.
And
walk
if you're 15 minutes late, they send you home. They do not let you come into class. They do not let you go to clinical. They do not let you come to lab.
Really?
Yes.
Wait, 15 minutes?
Yes.
Once?
Yes.
Okay, so if you're 15 minutes late to class,
They will usually tell you to go home. They usually say you don't come in.
Okay,
Depending on the professor.
because that disrupts it makes sense because it disrupts the whole class and,
If you're not going to be on time for class, how are you going to be on time for clinical?
that's true.
They're
But
trying to teach you.
how many strikes do you have?
Oh, I don't know.
Okay.
I don't show up
you're
late
on
for
time.
class.
You're on time.
Yeah, I
Well
don't.
done.
Yeah.
Yeah, I was about to say, okay, you guys seem to be on time.
Yeah.
Okay, so you get, okay, that's, like, I have to write this down, strikes. Okay, late strikes.
I think it's in the syllabus.
It is. You think so?
I think so. I'm
Okay.
trying to recall what their policy is. I mean, I know it may be in the nursing handbook as well.
Yeah, they're probably there's a handbook probably. Yeah.
Is the nursing handbook something you get
Yes.
Every semester.
every semester?
Mhm.
Okay, so
You have to
is it-
sign off on it every semester.
Okay, so it's basically like terms and agreements
Yeah.
Yes.
that you
Mhm.
sign.
Dismissal
Like, I have
policy.
read this.
Yes.
I've read this. Okay, is it digital or is
Yes.
it? Okay.
The
But
only-
you still have to sign.
Yes.
The only thing you have to print out is the agreement sheet, is the sheet where you sign and agree with to the terms of the handbook. But everything else, they're digital.
Okay.
You just print out the sign-up sheet. Yeah.
Okay. So it's like a strict.
Oh yeah, they're very.
This is serious stuff.
Mhm.
I keep telling people nurses are the most serious people on this campus.
And Gordon in
Like-
particular, because they ranked 4 for a
Yes.
reason.
Yeah. Yeah, ranked 4, but also there is no messing around in nursing.
No.
No tolerance.
You're in.
Yeah.
Yeah.
Like, what do you want to do? You want
Yeah.
to become a nurse or do you want to go home?
How bad do you want it?
Yeah, exactly.
Basically.
Okay. So what else should they not do?
If you don't perform well on a test or assignment, don't be rude to the professor.
Okay.
Or try to be upset with the professor. It's okay to be upset, but be respectful, because you still need to pass that professor, and don't try to burn bridges with the professor.
Okay. That's a good
Because I
one.
remember the first semester in the BSN program, there was a teacher. She was sort of new, so she was sort of trying to find her way through, and a couple of students didn't do very well. And I don't know who the student was, but they must have something crazy, because we got an email from Dr. Bishop saying it's okay to be upset, but you not have the right to be nasty towards the professor. If this continues, you will be kicked out of the program.
Okay. That's good.
It's
That's
not the
great.
professor's
Yeah,
fault they failed the test.
Yes, that's
Exactly.
great though. Yeah, you have to take accountability.
Yeah.
Something we'll be touching. I mean, something we will touch on every single podcast. I feel is accountability and self-awareness. You have to be self-aware, but you also have to take accountability. If you do fail a test, it's probably your fault.
Right.
I mean, because based from what I've heard, and this is just the 4th episode, the professors are bending
They'll
over
meet you halfway,
backwards to
yeah.
help you.
They'll meet you
I mean,
halfway, yeah.
Yeah.
They
Yeah,
really do.
yeah.
Yeah, and the fact that they have, I think, one faculty that's just there to help you if you're struggling with your exams, that's a good allocation.
Mm-hmm.
So I mean, they seem to have all the resources possible for you to succeed. Like
Yes.
we want
They
you
want
to
you to
succeed.
do well. They
Yeah.
do.
Yes, and that's what I've gotten from all of them.
Mm-hmm.
Like we want you here. We want you to succeed. We don't want you to see fail, and it's okay. Like if you fail a test, we want you to do better on the next one.
Right.
So if you fail, it's most likely is your fault.
Right.
Right?
Right.
Yes.
Okay. So hopefully I'll be able to get her here. I think I can't remember her name now. Johnson, I think, is the last name that takes care of exams if you're struggling with exams. Because I want to ask her a little bit about that because I know people freak out for exams. Now I'm not in the nursing program yet, but people freak out for normal exams. So I can just imagine, I can just imagine how it is freaking out for a nursing exam. Because for the T's, I was just calm. I was like, you know what? I did the test. I did what I can do. You know, I mean, it is what it is, you know, but freaking out won't help you in the nursing, I'm assuming, either. Like you should stay calm and collected as much as you can. Is that
That's correct. Start thinking of how you gonna correct the problem for the next exam. Don't be so stuck on the last exam because there's nothing you can do about that exam. Just put it behind you and move forward.
Can you fail? So let's say you have 4 exams. Is it the same as outside where one gets dropped?
Mm-mm.
No exams. Get
No
dropped
rounding,
here.
no rounding or drops. No.
No rounding or drops.
So if you make an 89.9, that's your grade. 89.9.
So it's not an A.
Mm.
It's a B.
Right.
Okay. So let me ask you this then. If you fail one test out of 4, do you have to redo the class?
No.
No.
Okay.
You should be fine because there's a lot of other assignments mixed in there where if you just fail one exam, but you're doing what you're supposed to do in the other exams and the other assignment, it'll balance out.
So as long as you stay over 75,
Yes.
which is what this college requires, is 75, you're good to
You
go.
should be fine, yes.
You should be good to go.
Yeah.
All right. So are you guys aiming to graduate with all A's, or how is the mentality regarding this? Because
I'm just trying to pass.
They would
just
tell
tried
you to abandon that mentality on the orientation.
okay.
If you used to one of those students who used to get all A's, which I was, they say abandon that mentality. Like I told you in the beginning, I got a 3.0 and I'm hanging on to it. I've been being my way through the school.
Okay. So I think that may come as a shock for a lot of people.
Yes.
Because I know, so the BSN we said is a lot more competitive. A lot of the people I know I'm talked to, they score straight A's.
Mm-hmm.
All right. And during our anatomy here, I wouldn't say drowning, but it was just so much. I was a little bit overwhelmed by the amount of information that you had to learn, especially if you do anatomy. You have the 200 plus bones that you need to be like, you need to know where this is located, you need to know where this is located and everything, that you have to know. I know for nursing it's going to be the same, but a lot of people were aiming for an A in anatomy and they actually got an A. So you're saying now on day 1 they will tell you let it go.
Let it go.
If you get a C, that's perfect.
You're
That's
good.
fine. You're fine.
That's perfect.
That's right.
Okay, so C's get degrees.
That's
is,
right.
That's
is
right.
is an actual thing.
That's
Yes.
right.
Thing.
That's right.
All right, so there you go. For people who are listening, if you get a C, you're more than good to go.
Good to go.
I am great hands-on bedside person.
Okay.
I'm not great sitting at the classroom and listening and trying to take all of that in. And I have to go home and read and reread and write it down and reread. That's a lot of time to do all that. But if you put me in the setting and say, okay, remember we learned this, this, and this. Here's the drugs we're doing. And then I'm like, oh, I got it. Like it makes sense now. And I was able to see that, especially when I was on the stroke floor with a lot of the heart medications. She had 12 heart medications, but they were all for blood pressure, diabetes, glucose. I mean, and I was like, she's like, we're going to hold this because her blood pressure's to a manageable level. And I'm like, oh, okay, I see why now. So
on the orientation, I'm not sure because when I first got to this college and did my first orientation, they took me to the nursing building because they send the nurses to the nursing building and they divide you. And I saw this and I will not forget it ever. And I don't know if this was just specific for nursing, but when we got in, they had an image and it said, there's a quote in Arabic that I just love. It basically goes like, tell me and I'll forget. Show me and I may remember. And then, depending on how you want to translate it, but join me and I shall remember. So if you join me and do this with me, I will remember it. It's the same concept where you're saying
yes,
that if you tell me, I'll forget. If you show me, maybe I'll remember. But if you're doing it with me, like hands on, yes, I will remember that because I'm putting it into action.
yes.
And they had that quote on the PowerPoint
Oh, nice.
on a presentation. I was like, whoa, this is some high class stuff right here because I've never heard this before. But I think it was just specific to nursing. And now when we get back to it, I'm like, okay, you know what? The nurses here or the professors here are actually serious about it.
Yes.
Mhm.
I mean, I've talked to them and they've helped me with roadmaps, getting into nursing.
Yes.
But this is how they act on a day-to-day basis.
Yes.
They're
Yes.
actually there for you.
Yes, absolutely.
Like they want you to succeed.
Yes.
Okay, so back to accountability. If you fail with all that, you need to start thinking about what am I doing wrong and what
Exactly.
what can I do differently?
Exactly.
Right?
Yes.
Okay. Let's jump into your wholesome story.
Well, my wholesome story is we had this patient at clinicals who was there for a lot of different health conditions, and his
Right.
kidneys were failing, diabetes and stuff. But the following week, we came back, he was stabilized, and he was on their way to being discharged back home.
Okay. That's great.
Yeah.
So you guys don't have any other stories that's like, you know what? Maybe this, that. Nothing.
Nothing wholesome.
nothing real.
No.
No,
Wholesome.
nothing wholesome. I mean,
Yeah.
I'm talking about like horror stories.
Oh,
or-
no. Nah,
Have you not heard from your classmates any horror stories?
Not yet.
Really? Interesting. Yeah, last episode, it's gonna be released today at 8. The stories were wild, but they're in the last semester, so they've heard some stuff. But yeah, I mean the stories are just, oh my god, I've heard it and I was like, is that even a thing?
Well, in your last semester, excuse me, you're spending 12 hours.
Yes,
In
preceptorship.
clinical.
Yes.
What?
You're spending 12 hours in clinical.
Like straight hours?
You're working
Yeah.
7A to 7P or 7P to 7A
Okay.
because as you progress through your semesters, your clinical hours will increase, and you have to have X amount of hours per semester in order to pass your clinical. So you're in your final semester, you're spending probably 55% of your time in clinical.
Yes, you're your preceptorship.
Okay, so clinical is not an actual class.
It's hours. They count your clinical hours.
Okay, they count your clinical, but it's not.
So
like
it's
an
going to be
actu-
attached to your med surg class or to
Okay.
your acute care class or
Okay.
to your mental health class.
Okay, so it's part of the class.
Yes.
Okay.
And you either satisfactory or unsatisfactory. There's no grade. You either satisfactory or unsatisfactory.
Okay, so you either do good or you don't do.
Right. And when you're in
Gotcha.
clinical, they give you check-offs. I forget what the clinical learning outcomes.
Okay.
And it's anywhere from 1 to 15, but each one has subsections that you have to do. And those have to be completely filled out and checked off as satisfactory in order for you to pass clinical.
Okay, so walk me through a clinical. You're in a class. They say, okay, we're talking about. Give me one. Just give me an example of any.
Using evidence-based practice to provide a care plan for your patient.
Okay, and then you have to do that on your clinical.
On your clinical day, when you're
Okay.
there, you have to find the evidence-based practice, let's say, for respiratory failure.
Okay, so which class are you in now?
I'm in acute care for med surg.
And acute care has clinical.
Yes.
Okay, so let's say I'm in acute care
Mhm.
clinical.
Mhm.
All right, and I started the class, first day of class. Do they tell you it's time to start to prep for clinicals or nothing? They just okay. So when it's time for clinicals,
They'll
tell
send you your schedule when you're going to go.
Okay, so you don't choose where you want to go.
No.
Okay, where is that? Is that part of your last clinical thing? Like when you can put like I wish to have clinicals on these are the top 3 places. You got nothing like that?
They ask you where you live, and they
Yes.
try to find a facility close to your house.
Yes.
Because there's only so many nursing teaching hospitals, and
Okay.
there's so many nursing students in Georgia.
Okay.
So like my clinical now is 67 miles one way from my house.
Okay.
So I have to leave at 5:15 to be there by 7:00.
Okay.
But that's only because there's no other availability in these other nursing hospitals for me to go. So that's where she had to put me.
Okay.
You know, some people would fuss about that, but I'm like, that's where there's a reason I'm supposed to be there. So I'm just going to stay there and I'm going to go and do well.
All right. And when you go into clinicals, you have to be satisfactory.
Mhm.
But this is all building your experience
Right.
and applying the information.
Mm-hmm.
Clinical seems. I mean, did you guys get overwhelmed?
You'll enjoy it. You'll enjoy it because they'll have you
Okay.
ready. Because the skill check off during fundamentals, you'll enjoy it.
I know that I'll enjoy it because I'm a hands-on person.
Yeah,
like
you'll
you.
enjoy
I
it.
love being hands-on. I hate being in class, but I love being hands-on. But let's say you go to which hospital were you assigned to?
This semester I'm at the Roosevelt Rehabilitation Hospital.
Okay, so you go to Roosevelt.
Mm-hmm.
You park your car.
Mm-hmm.
You walk in.
Mm-hmm.
What do you do?
You go and you get your report
The
from
report.
the night nurse.
Okay.
Once you get your patient, whoever your clinical instructor assigned to as your patient, you then have to do your head-to-toe assessment on your patient. You have to read the orders from the doctor. You have to get your meds ready, get those verified. If it's that patient's day for a bath, you help with the bath. You do your non-pharmacological rolling the patient, elevating the patient. If it's their day for labs or blood work, you pull the IV, you do that.
But on your first day, do you not like go and talk to someone? Meet up, check off.
You're matched with that patient's actual registered nurse that
Okay.
day. So if she's doing rounds, like the first day I was at Roosevelt, I was assigned to the respiratory therapy team. So all we did all day was trach cleanings, trach suctions, ventilation, CPAPs, stuff.
Okay, so I was thinking, when you first go in, you're like, "Hey, my name is Ali. I'm, from Gordon State College, and
Yeah, they'll introduce you. The clinical instructor will introduce you to the whoever you
Okay, so
with, yeah.
it's not like you go to the front desk and say, "Hey, I'm the clinical from this college." It's like, "Well, thank you. You're here. Here you go."
Yeah.
No.
I mean, well,
yeah.
Well,
I felt that way.
you
Yeah,
felt
like,
that way. Okay, you
like
you
I
have a
was
diff-
introduced. Here's your nurse. Go do what she will. Well, she will allow you to do within your scope of practice as a student nurse.
Okay.
Yeah.
And
Yeah.
how? Because you didn't agree.
Well, basically, like I say, at my clinical site, we had a clinical instructor. I got the same clinical instructor 2 semesters in a row,
Okay.
and she basically what she does is, this is my student. He's here his second semester. He wants to practice this skill today, that skill today. So if there's any opportunity to do that skill, like IV, starting the IV or catheter or anything, could you let him help you, and stuff like that. But she right though. Once you get in there, you pretty much gotta
Like it's like there is no time for introduction and a cup
Yeah.
of coffee.
No,
This is how
no.
you do stuff. This
You
is
pretty
like-
much hit the floor
Yeah,
running
that's
with
it.
them.
Yeah, that's it.
yeah.
Mm-hmm.
Okay, so basically, just be ready. As soon as you land, you're running.
And then there's some nurses that don't want a student with them, and they straight up
That's
tell
true.
you, "I don't want a
That's
student
true.
with me today."
Really?
So
That's
then
true.
you're stuck with a nurse that doesn't want to teach you anything in the field.
Wait, what?
Yeah,
That has happened to you?
that's not happened to me, but it's happened to somebody in my
It
cohort.
hasn't happened to me either.
Okay. Could you share some information
We
about
were
that?
at a facility doing a clinical.
Okay.
It's actually a student who is already an LPN.
Okay.
She works at that hospital that we were at.
Okay.
She's doing her clinicals there. And the nurse was just rude to her, like, "I don't got time for this today. I can't believe they put me with you today." Da, da, da. She finally had to tell her, "Listen, I actually work here at this hospital on a different floor, so this is not making you look good. I'm here to learn from you so that I can step into your shoes so you can move on or go do better things. And you have an attitude like that, it's not helping me learn and helping me proceed and be satisfactory in my work."
Okay.
So, you could tell by her body language, she still was not happy having a student.
So if that happens, do you guys know? If not, I'll have to write this down as a question too. But let's say that happens and that doesn't fix the problem. Are you allowed to switch nurses?
under extreme circumstances, but it's mandatory. If you're a nurse at a facility, most facility, it's mandatory for that nurse to be OB. It's mandatory. So
yeah, but
yeah.
okay.
I know what you're saying,
so,
but it can't.
so let me. When I used to work at the airport, we got mornings at the airport are the busiest time, I would argue. But I had a supervisor. She was supposed to teach me how to check people in. She's been working there for a few years, so she was quick on the computer. I was quick, but I wasn't that quick because it was still my first few days. I had no idea what to do, and I was trying to navigate through the short commandments to only use the. I didn't want to use the mouse. I want to use the keyboard because when you do that, this process is much faster.
Right.
We were sitting on our business class desk, and business love to do things a little bit faster. That's why they have their own lane and all that. So she said, when a business class, she's like, you have to be a little bit faster, and she was, stressing me out. And I was like, bruh, can't do that. And she's like, I need to learn this. Just tell him that, hey, he's new. They probably would appreciate that. Because a lot of people, from my experience, when you tell them he's new, he's trying to learn, they're like,
show you some
Exactly,
grace.
yes,
Mhm.
you know what, you're good to go, you're doing great.
Yeah.
But no, she didn't do that. And after that, I couldn't take it because she continued like that. And I went to another supervisor and said, hey, I think I need someone else to, I need to shadow someone else and be with someone else because this is not going to work. And they replaced me.
Yeah, they'll replace you.
Pretty quick.
Yeah.
But I think that is even more detrimental when it comes to nursing because if you have someone who's like, I don't even want you here today.
I mean, if there's other nurses on staff that they can float you over to, then they probably will.
Yeah,
but,
they will. Yeah.
Yeah. It was definitely reported and mentioned. So hopefully the next person that comes into that clinical site won't get with that nurse who doesn't want to teach anybody anything.
Okay, so that's important to do.
Mm-hmm. Absolutely.
Okay. So what has been the hardest clinical-wise for you guys? Beside the drive, maybe, that's 67 miles.
I think probably for me it would be OB.
What's OB?
Women's health.
Okay.
Where we're delivering the babies and dealing with the babies because I don't want to do it. And I know that's not where I want to go.
Okay.
And
Have you done it?
I did the clinical, but it was a slow day. So I didn't really feel like I even got to experience it if I even thought I wanted to do it. I really feel bad for people that want to go into that field and you go on a slow day. I mean, you can't help it, but they didn't get any hands-on experience or any it's either feast or famine when you go to the hospital, depending on the day.
Yes.
Okay.
Saturday we had 11 patients deep and we hit the floor running. But the week before we had 4 patients. So we had time to do head-to-toe assessments and wound cleaning and take our time on our paperwork and that kind of thing. But if you're wanting to do OB and there's one nurse or one mama and one baby.
Are you allowed to request to go to additional hours, take additional hours?
You can. It's up to your nursing instructor if you want to be there when they're there.
Okay.
Or the clinical instructor, rather.
All right. I'm going to note this here.
You would just be able to shadow, but you can't do anything.
Yeah.
Yeah. So because I'm saying if you're going into OB and it's a very slow day and you would like to experience it to know if this is what you really want to do, then maybe an extra hour, extra day would do something. So what would you say have?
Going to clinical on days where they're shorthanded, because see, when they're shorthanded, there's nothing really the facility can do. They be so shorthanded, they be so busy. Like you try to get in when you can, but they really can't help you. It's not that they don't want to; they can't. That probably the only time I had something close to what we talked about earlier, where they couldn't help me. It wasn't because they didn't want to, because it was shorthanded.
Would you say it's important to then just like be adaptable?
Yes, you have to be very flexible. Yes, absolutely, yeah.
Okay, so is it dealing with ambiguity in the sense of you hit the floor running, it's super busy. They don't have that much time to explain everything to you.
Yes.
But you should just adapt to that. And
I would just kind of sit back and watch.
Yeah.
And just say, in that way you can still say, I observed this.
Are you allowed to take notes?
Yes.
Mhm.
Okay, so have you taken notes?
Oh yeah.
Yes.
Okay.
You just can't put in the patient information, like confidential information down, but you can take notes, definitely.
Okay, so you can take notes and then just like, hey, I saw you do this.
But
Could
when you
explain?
when you go to fill out your clinical evaluation form, you can say, I observed this, and then you can explain busy day, short staffed, which is why I didn't get to physically check off and do this.
Okay, this is maybe off topic, but do you guys get lunch breaks on clinicals?
It depends.
It depends.
Mm-hmm.
Okay, it's not always.
Not always.
Not always. Okay,
Mm-mm.
so if you're lucky, you get it. If you're not lucky, you won't.
You can
get
go
it.
grab a cheese stick or a box of gummies out of the thing and keep going.
Oh, okay, is that provided to you?
No, the stuff you bring.
Okay, so
Yeah.
you have to grab your own snacks.
Oh, yeah.
basically.
I mean, unless you use the vending machine. But yeah, you don't have time to run to the cafeteria and grab anything or anything like that.
Okay. Well, do you guys do labs?
Yes.
And we have. Well, I've seen the labs in here. I mean, they are fantastic. I have to say, it looks like a hospital.
It does.
But what is it that you guys do in those labs? Is it to prepare you? Is it customer service is not the right way, but is it just to practice how you're gonna handle
Yes.
the patients?
They're teaching you proper procedures.
Proper procedures.
So if it's a sterile procedure, they teach you that, and they teach you that, they teach you that, and then you have to go in there and check off on it.
Okay.
If you don't do it the first time, there is an opportunity to come back and retry it.
Okay.
But if you don't check off on these things, you don't get to go to clinical. Because you have to
Oh.
know how to do catheters. You have to know how to do an IV. You have to know how to do basic hand washing, wound dressings and stuff. Because you're going to be presented with that stuff in the hospital.
Okay. So you have to do all that.
Yeah.
And you have to know what they're. So I'm assuming you have to ask questions in the sense of if you don't understand what something is, you
Yes.
ask. For example,
Mhm.
OB. I was like, what is OB?
Right.
So you have to do that.
Yes.
Because you can't act like, oh, no, I know what she's talking about. And then put in, the hospital. And she's like, do this. And you're like, what's that?
You have to ask questions even in class because of the medical terminology.
Yes.
It's
Oh,
almost
yeah.
like a foreign language. So you can be like, dysanuria. You don't know what that means.
I have no idea what that
You know,
means.
But if you know what urea means, which means urine,
Yeah.
the dis part is without, but then dysanuria is I think it's pain during sexual intercourse or something like that. But if you just go and say, okay, dysanuria, you're not going to know what any of that means. So when you're presented with medication treatment options, it could be like, well, this person has diabetes, dysanuria, UTIs, something else. What are you going to treat? I don't know.
So you said you had a psychology degree, right?
I did. Mhm.
Okay.
I do.
And you do. And you said you were a teacher.
Science education.
Okay. So now let's compare it because I know people do not ask questions in the core years. Is it different in nursing? So when I was sitting in microbio, it felt like sometimes I had a conversation, one-on-one conversation with a professor because I kept asking so many questions. But I also know a lot of people do not ask questions even if they have that question in their mind. So they don't. They just go by and they're like, I'll get it later. But for me, I stop and it's like, hey, could I ask you about this? And they explain
I
it.
feel like a lot of
Is it
people go
different
to the
in
professor
nursing?
after class and ask questions
So it's
or
not,
email a question later. Yeah.
Okay, so it's not in class.
I mean, some do, some don't.
Yeah, but I mean, so what I'm asking is more like the frequency. Do you guys have a lot of that in class?
We have a lot of engagement in class
A lot of engagement.
because the teachers, like, if they see that you shy, they're gonna like call on you intentionally. They're gonna see,
Really?
Yeah, they try
They-
to. See, they,
They
don't-
do call you out.
Yeah,
You do
they-
get grades for class participation. That
Yeah.
is part of your syllabus.
Mm-hmm.
Okay, so you
Mhm.
have to participate.
Yeah, a lot of it's case studies, group work, because your cohort, you're going to be with them for 2 years. Those are your people. You have to learn to work with everybody because when you go to the hospital, like you said, you don't know who you're going to be working with. So when you go to do your checkoffs on your vitals, this one girl came to me. She said, "I need to see if I can feel your pulse because I got to check off." And I said, "Why do you need to see if you can feel it?" She said, "Because I need to make sure I check off." I said, "You don't get to choose your patients, right?" And she was like, "Oh." Like it just went off in her head like she did. I'm like, if you go into a patient and they've got a thready pulse, good luck trying to find it, first of all. But there's other pulses for you to check if you can't find it here or
Yeah.
here, But, and then one girl didn't want any old people in her group. So I made it a point the next day to go into her lab group and made her teach me something. She was so upset with me. You could have seen the look of disgust on her face. Like, well, what are you doing here?
Really?
Yeah.
Why?
That was just her personality. She made her own clique, and she wanted those same people in her clique all the time.
Okay.
But you can't do that. You've got to, and I mingle around and talk to everybody and work with everybody because that's how it needs to be.
That's interesting.
You know,
because that's based on the students I've talked to that are not nurses yet. They seem to think that you have one clique and you can just work with that clique throughout the whole semester.
They'll put you in spontaneous groups in middle of class. They put you in spontaneous groups in labs.
Okay, so they do that.
They put you in spontaneous groups for clinicals.
Okay, so the professors do that.
Yeah.
Okay, so wait. So clinicals, you can be sent along with a classmate to the same hospital.
Yeah.
Okay.
There's 5 other students in my cohort that are in my clinical.
Right
Same.
now.
Same here. Same.
So
here.
do you guys cross roads in the hospital?
Yeah.
Yeah.
Okay, so it's just like, hey,
hands on. We need everybody's help. Come help now. And yeah, we sit down and discuss like different things that we did today, or something that might work for me didn't work for this one, but she can say, hey, well, this is what worked for me, and it might work for somebody else.
But see, that's something that's good.
Yeah.
And based on what you're saying now, most people accept working in groups, but working in groups is a lot smoother. I'm working in groups here in core years, and I'm like,
I still hate group work. I still hate it.
Okay, but is it a little bit more tolerable in nursing?
I think so.
I think so too.
Because you're working for a main goal.
Yeah, everybody got the same common goal. Yeah, I agree.
Okay. So yeah, that's why I said in the beginning, nurses want to be there, and they're a little bit more serious about. I wouldn't say a little; they're a lot more serious about nursing.
I feel like in this cohort, though, I can go to anybody and say, "I need help," and they're like, "Okay, what you need?" Whereas the first cohort, I felt like, "Hey, I'm not doing something right. Why are you passing and I'm not? What are you doing?" And they're like, well, you know what? We don't have room for another study person in our group. And I'm like, I don't want a study person because I have a family, so I don't have time to do that.
Yeah.
Or, could you stay extra 15 minutes or call me? Can we do like a FaceTime thing? And nobody was willing to give me that extra time.
Okay.
Whereas now in this cohort, I feel like I could talk to several people, probably everybody, and be like, hey, I'm struggling. Do you mind helping me? And they would give me that extra time.
So I don't know if this helps because we touched on this with the last group. Okay. They were very open to people approaching them.
Yes,
I think this is a little bit different now with the second years who are about to graduate, and then you are talking about maybe second year's first semester. I don't know. I haven't interviewed any yet, but they are very willing to help.
Yeah.
I mean, one of the girls was like, "Hey, if someone comes up to me and says, hey, do you want to grab a cup of coffee and talk about this?" She would be like, "Yeah, when? Now?" That's how open she was to help. And a lot of people said, or the whole group really said, if you want help and you approach us, we would be more than willing to help.
Yeah, my group's like that too. My cohort's like that too. Yeah.
Then you must have been unlucky, I guess, with the first cohort.
Yeah, I voiced my concern. I was like, I don't feel like this is a family. I don't feel like anybody's willing to help me.
Yeah.
I've asked multiple people for different types of help, and I'm still stuck here by myself. So I think it was a blessing that God said, you know what, this is not the time for you, and made me start over.
Okay.
So.
Yeah, that's good. I was about to say, I do not like the overused word of family because, every work you go to, you're like, we're a family. I was like, no, we're not. We're a family on a TV show that the camera is on us and we feel like we have to fight all the time to create drama. I was like, yep, no, we're not doing that here. So when it comes to the word family, I'm a little bit, wary. But it sounds like from your experiences that people are very, very willing to help.
Absolutely, yeah.
And then you always have someone.
Yeah.
In every group that were like, you know what, I don't want to work with this, and that's fine. Don't force it. Just go through.
Yeah, in my cohort, we only got 3 guys. You don't have a choice but to,
But then you have how many? Do you guys know how many people you have in your class?
Right now we got 42 in our cohort because we had 43.
42.
We had 43, but one didn't make it, so we got 42. So
I want to say 44.
So you have 44.
Mm-hmm.
Okay, so that's what I've heard. You're about 40 to 60 people in a cohort, and if you're 60 people or 40 people, I mean, if 4 of them don't want to, you still have 36. You still have a lot of people to work with, and I think that's something you should keep in mind. Yeah. Just go around, ask for help.
Yeah.
You do have to respect some boundaries, I'm assuming, too.
Yes.
Some people can have their days off and all that. But in this podcast, we have a tradition. I'm trying to create a tradition here. And basically, where people tell the next guests what they want them to do. So, have you guys seen the movie Pay It Forward?
No, never heard of
Okay.
it.
Okay. It's a cliche movie. It's a very sad movie, though. So, if you're, I don't know how sensitive you guys are, but if you want to cry one day, you can put it on. It's pretty sad. But it's a good movie. I watched it last summer, I think. And it was basically you do something and it creates a ripple effect.
Okay.
All right. Now, I have to tell you, full disclosure, I've been slammed the past week. So I really just forgot to bring you what the past group did. But I will email it to you.
Okay.
That's a promise. I'll email it to you what they want you to do. But what would you guys say to the next guest? What would you tell them to do? It's a positive thing, a good thing.
Well, what I would want the next guest to do, I would want them to highlight some of the things that they did to get through obstacles as they were going through the program, so that way the next cohort can sort of apply it to their own situation if something similar comes up.
Okay, so share the knowledge that you have and don't
Yeah.
keep it for yourself.
Yes.
Okay, that's a good one.
I would say fear is a liar.
Fear is a liar.
Hmm.
All right. Could you expand a little bit on that?
That's part of Satan getting into your heart, getting into your brain.
Okay.
If he puts that fear into you and you get stuck on that fear, just like you're getting stuck on that bad test you just had, that's going to create negative energy in your environment. That's going to create a negative outcome in your brain, and that's going to cause you to essentially not do well.
Okay. Yeah, that's a good one. So don't. Okay, fear is a liar. I think we had one, if I remember correct. Delayed, not denied. I
Yes.
think one
Yes.
of the girls
Yes.
said, and she said, just because you got delayed, it doesn't mean you get denied.
Right.
You know, and I thought that was a pretty good one.
Yes.
So thank you so much
You're welcome.
for that.
Okay.
So, what are your thoughts about the podcast so far? Was it as
Informative.
I mean,
yeah.
you were just on it? You're like, yeah, my man, podcast, I'm on. When do you want me to come here? But you didn't have any restrictions either, I would say. But because you saw me walking around on the spring fair
Hmm.
and talking to the students. So what were your thoughts? Was this something you had expected, or was it more like, oh, I didn't expect this at all, or what's your thoughts about the
Well,
podcast?
just
Because
like
I'm trying to tell people to
You
get
didn't know I was a
married.
nursing student, but you knew I was at the registrar's office.
I did,
So
because we're colleagues.
the same thing is I don't tell people in the nursing program that I'm in the registrar's office. I just want to be a student there. I don't want
Okay.
to be, hey, I need help with my graduation app. I need help with this. I need help. How do I do this? How do I do that? Because if something happens, well, Erin said to do this. I'm like, you just need to go see the registrar's office. And if you get stuck with me, then that's fine. But I don't advertise that. So
Okay.
when you approached me, you're like, hey, wait a second. You work here. You need to do the podcast. And I was like, okay, that's fine. So
Okay.
I'm just not a shy person. And I'm willing to teach you anything that I can and help you in any way that I can.
Okay. So what were your thoughts?
I felt like this was a very informative podcast, and I try to do things to be helpful. I try to spread awareness.
Yeah.
Yeah.
All right. Well, if you guys have anything to add, you can just shoot me an email, and then I could just mention it on the next episode.
Okay.
But like I said, it's I really don't plan this a lot. I mean, the questions, because I don't know who's sitting in front of me.
Right.
It's very different. I've had four episodes now. Not one has been like the other.
That's good.
That's what's, for me, it's cool. It's very cool. I love it, But I think what people think is that you have a bunch of questions on your list
Right.
and you want to ask them and go around the table like, hey, what do you think? What do you think? What do you think? And then once they're done, it's like, okay, let's go to question number 2. Kind of like an interrogation,
Right.
But this is just a conversation. I would love to, I love to have conversations with people, and what better way to spread knowledge about nursing than having a conversation about it.
Right.
And
Right.
that always just felt like a conversation.
Yeah,
Yeah, it felt like a conversation.
I would say a good takeaway, though, with nursing school is be consistent.
Yes,
be consistent.
Be
Yeah.
consistent.
Mm-hmm.
Okay.
Yep.
So, consistent in everything or consistent
Yes. Yes, in your studying, in your abilities, in your time, in your just anything. Because as long as you keep that consistency going, you're going to maintain that momentum, that forward momentum.
Okay.
As soon as you have a setback, like a bad test grade, or you failed your check off, that's when you start getting set. I'm not good enough. I can't do this. I don't want to do this. This is not made for me.
Okay.
I mean, we've had people make one bad test grade this semester, and they were thinking about withdrawing. And I'm like, it's one bad grade. We've still got 2 other tests to take and all these other assignments to put in there. Don't get stuck on that.
Exactly.
Okay. Consistency is key.
Absolutely.
I love that.
Yes.
I love that. I'll make sure people know about that.
Yes.
So do you have any final things you want to share?
We need you. We need you in the field. We need nurses.
I'll do my best. I'll do my best.
We need teachers too, though.
Yeah, that's true. Yeah, no,
Mhm.
I'll do my best. I'm really looking forward to it. I mean,
Okay.
it's what is it? Wait, you only have 4 days left? Well, 5 if you count till 5:00.
Yeah.
Kind of till we find out if we get in or not.
Oh, yeah.
So that's gonna be
Oh, you'll know by the 20. You'll know.
by the 28th.
Yeah, you'll
Yeah.
know.
Do they usually send it? do you know?
Yes. They'll send it to you
Like
by
in
3
the-
o'clock.
3:00. Okay,
Yeah.
so
I'm like, I don't remember.
you don't remember. Okay, you know. Thank you,
Yeah.
man.
Yeah.
No, but it's gonna be interesting. It's been 2 long years. It's been 2 long years. I can tell you
That's
that.
generally how long it takes to do your prereqs. About 2
Yeah.
years. Yeah.
It's been 2 long years.
Cause that's how long it took me when I left teaching and retired from teaching. It took me about 2 years to do my prereqs. Yeah.
Okay.
Cause see, for the BSN program, you had to take statistics. So
Mhm.
that's the thing about it. I had to, yeah.
Yeah. Did you?
I've taken on my BSN core classes already.
Oh, you have.
Yeah.
Okay.
Mm-hmm. Just
What?
wasn't good enough to get into the BSN.
Okay. Okay.
So I got into the associates, but yeah.
Well, you can
Okay.
bridge over.
Oh, yeah. Yeah, yeah, yeah.
You can.
Yeah.
Yeah.
Once you get her ASN, she can just bridge over and do it online.
Wait, you can't do it online.
You can? Mhm.
Cause she's already RN, she's just doing the online community development and stuff. So she's
Leadership management.
leadership
stuff.
management. Yeah.
Mhm.
Okay, so it's not over.
it's-
No, no.
Okay, so
no.
once you're doing ASN, would you say it's easier to get in?
Easier to get in ASN. Absolutely.
Yeah.
So
yeah.
you
Yeah.
just get into ASN and then you bridge over.
Bridge
You
over.
can bridge
that-
over, and I think it's 6 more months
6 more months. Yep.
after you bridge over.
Cause see, we have a summer. See, I have to come back this summer. See, she doesn't come back this summer for ASN.
No, I heard that
Yeah.
BSN programs.
I
are
would
just
prefer to
really-
go through the summer, though.
Yeah, I know. Yeah, cause I said the leadership and all that stuff. We do that over the summer.
Okay, so basically the summer classes that you take in BSN
Yeah.
are the ones you're bridging over.
Right.
Yeah,
so it's,
basically.
Right.
you're only taking the classes you're
Yeah.
taking.
Yeah,
in
you're already
the
doing your
summer.
practicum and associates,
Yeah.
so I
Okay.
don't have to go and do clinicals
Mm-mm.
when I bridge over to do my BSN.
Yeah.
I should technically be working in a hospital field, healthcare wise, and then bridge over to do
Okay.
that.
Okay, so there are a lot of options.
Oh, yeah.
Absolutely. Yeah.
Okay.
Just like there are a lot of options with nursing. You may not want to be a bedside nurse, but that doesn't mean you can't get your ASN and still do other things.
Yeah.
See, that's what I was thinking. Because I was thinking, I've been telling people, and I found this out, that if you want to get into a certain college, go to a college, community college, a cheap college, get your grades there,
Transferring.
yeah, and
Yeah.
then just transferring because it's a lot easier from what I've heard to get in than to initially get the acceptance letter. But people just want to do full blast, big college, day one kind
Yeah.
of thing. But I'm like, no, you can do that, but it's the same thing here.
Yes.
You
Mhm.
can't just bridge over
Yeah.
and
Yeah.
it's only 6 months.
Yeah.
Yes.
And you can take that online.
Yes.
Yes.
So I could still be working as a nurse and just take those classes online if my time management is.
That is
Fair.
fantastic.
Yeah.
That is a perfect way to end this thing with, because I'm like, you know what? I'll take this with me. I'll spread the word.
Oh, definitely.
Can you bridge here at Gordon?
Yes.
Yeah.
Like, do they have that?
Yeah, we have
Yeah.
a bridge program. We have an EMT bridge. We have an LPN bridge. We have an ASN bridge.
What's an EMT? I know what EMT
Oh,
is. but
ambulance.
Paramedic.
Paramedic.
yeah, but what do you bridge to?
ASN.
Your associates.
Associate.
Oh, really? So
Mhm.
you can do that.
Yeah.
Mhm.
And that shouldn't take long either.
No.
I'm assuming.
So if you go to like a technical college and just get like a CNA degree or a licensed practice nurse degree, then you can bridge over and get that RN degree, which is essentially what we're going to be.
Nice.
But he has the ability when he gets out to be a charge nurse and make decisions for a floor of nurses, whereas me, I would just go in, do what I'm assigned, and go home.
Okay, so management position
Yes.
kind of.
That's
Yes,
what BSN is for.
Yes.
Okay. All right. Interesting. All right. Sweet. Thank you so much for
You're welcome.
participating.
You're welcome.
You're welcome.